well, congratulations.
Good.
Yeah, that's good. Yeah, yeah.
And hopefully in next few weeks we'll be starting a practice in Islamabad as well. So
Hello everyone, this is Dr. Salma with Let's Talk Aesthetics. I have with me Dr. Kashif all the way from Peshawar here in Lahore, and I've been following Dr. Kashif for some time for all of the regenerative work and all the new advances he's bringing to aesthetics. So let's have a quick chat with him and see what is he up to. Welcome.
thank you very much. Hi, Salma.
Hello, how are you doing?
I'm good. I'm great.
I'm so glad to finally be able to meet with you.
Yeah, it's been mad, isn't it?
It's been crazy, and you've been all over the world.
Yes. Yeah.
So how often do you travel? I feel like you travel more than you are actually not traveling.
Yeah. Actually, yes. Possibly right, because I'm probably traveling 2 to 3 countries almost every month. So it's a lot of traveling, trainings, and conferences.
Yes. So you moved from UK at some point, yes? How long have you been here in Pakistan?
It's now coming just over 5 years now.
Oh,
Yeah,
okay,
just
so
over
relatively
4.
new still.
Yeah.
Okay.
Yeah.
Where were you in UK?
I was in North Wales and in Manchester.
Manchester.
Yeah.
Were you born and raised there? Or
No,
did you move
I
over
was
there?
born in Pakistan and I went over in early years of 2000. So actually in 2003, I went there, and since then I've been there.
Okay.
I moved back finally to Pakistan just before COVID.
Okay. What brought you back? Was it COVID or just like something
Yeah,
else?
it's probably more like coincidence really, because we were visiting here. We were actually in the process of moving abroad to Canada, and
Okay.
then we decided, probably spend some time home.
Yeah.
And that's when the COVID hit and the plans changed.
Oh.
And we at one point thought of going back to England because my family was still there.
Yeah.
They actually were there until the end of 2023.
Okay.
So
That's very
I was
recent.
mostly commuting for the first 3.5 years.
Wow.
Yeah.
Talk about a commute.
Yeah.
So your family's there now?
Yeah, they're here now.
You have kids?
Yes.
How old are they?
Well, the elder one is now, he's 17. He's going to university now.
Yeah.
And the other 2 are young. So it's like 9 and 5.
How has the move been for them as a family? So the first 3 years, I think you were commuting, so you were not quite fully here.
Yeah.
I guess. In the last 2 years, like really the time that you're really here.
Yeah.
How is it going with the family?
Yeah, they're happy.
They're
Very
happy,
here, yes.
really.
We enjoy being in Pakistan.
Okay.
I think there's a lot of support, really, both from family and from friends. And end of the day, really, I mean, no matter where you are in the world, but they'll have Pakistani, you come back.
Oh yeah, you're right about that. Here I am.
Yes.
Yeah, very, very right. So you've been, so you have practice in Peshawar?
Yeah, I practice in Peshawar. We actually established a practice. It was a small practice to start with, and then we expanded. We've been expanding over past, few years now, to a point that I now run aesthetic medicine training program in Khyber Medical University. I'm the program director for the for the diploma that we were running. From next year onwards, we were hoping to have a master's degree in aesthetic medicine in Khyber Medical University, and we are expanding, as you'd say. We have one of the largest practices in KP and in Peshawar, and actually we are the first practice from KP to get a full healthcare commission license. So we had a very rigorous, inspection process in the last month, and we finally got our full license from.
Well, congratulations. Yeah, that's good. Yeah,
and hopefully in next few weeks we'll be starting a practice in Islamabad as well. So
all right. Well, congratulations. Yes, that is amazing. You are doing such a great work. I mean, I absolutely love the regenerative side of it, especially because that's where my passion is, and how you combine different things and bring out something even better.
Yeah. So one of the ways of practicing is, for me, is taking challenges. So what I tend to do is we do studies sometimes with my students and then with my associates in the practice as well. We have a full-time qualified FCPS fellow dermatologist in our practice as well, who helps us with running the practice, and then we have a full team of assistants as well. Um, and one edge that gives us is that we do a lot of research work. Like currently, we are studying stem cells in burns and stem cells in hair regeneration. I have had multiple, research and studies on mixing calcium hydroxylapatite with hyaluronic acid and platelet-rich fibrin, and then, other studies on exosomes as well, which recently got them published. So we've been doing quite a lot of work in regenerative medicine.
Well, that's
I
good.
like it really because it's challenging.
It is challenging and it's also needed.
Yeah.
A lot of people are doing things, but not necessarily, kind of putting it in a research and really proving that it is doing what we say it is doing.
Yes, that's right.
So that's amazing. So really great to see that.
Yeah.
And I'm so glad that you are actually in Pakistan and you're happy here.
Well, yeah, I'm very happy. I mean, yesterday I presented my recent work that we started doing, last year with the scar remodeling and scar regeneration with polyalactic acid.
Yes.
Now, these days, we are getting literally close to 90-95% clearance of acne scars, grade 3, 4 severe acne scars.
And that's a big issue here.
90-95% of clearance with the new treatment regimens that we have.
That is amazing.
Yeah.
Yeah, that's some faith. I mean, that's very common issues. So in your practice, what is the most common patient that you see?
Yeah, well, we see a lot of patients with hair, we see patients with pigmentation, we see patients with acne scars. These are common problems in our country, and luckily enough, we are capable and able to help them, and give them best quality treatment.
Do people ever come with like some weird or strange requests to make them look like this or that?
Yeah, I mean, it's quite normal, isn't it? A lot of people, they get influenced by social media. They watch Instagram, they follow people on Instagram, Facebook, and now some era of TikTok. People want to mimic others. Sometimes we get patients asking for unrealistic, results and expectations. Sometimes asking for having their lips overfilled or perhaps face overfilled. But I think a good physician is the one who knows when to say no.
No.
Yeah, and that's very important.
Yeah. How do you handle those patients? Like, not if you don't just want to say, like, how do you educate them?
Well, I mean,
do they ever come around, or are they just stuck in doing what they're doing?
Right. Yeah, I mean, it's one very important aspect of aesthetic medicine is understanding your patients and understanding their needs. And then sometimes when patients have complex issues, we have a very close liaison with clinical psychologists, so we get them involved and patients talk to them,
really understand them.
Yeah, and then we come to a point where we get an agreement. These patients are very tricky to handle, so less is more with them. So you always call them again and again. I mean, on occasions, give them a little treatment, not do over much, and then that kinds of keep their satisfaction at bay.
Very good point. Very well said. So patients always come and they will always ask you, give me some tips and tricks. They always want to know a few tips for how to keep the skin looking young.
Yes.
So what are your go-to tips?
Well, avoid sun to start with.
Yeah.
And use a good sun cream and a good antioxidant serum, anything like, a vitamin C at night. And anything with ceramides, you can use once at night. And I think that's enough for anybody. Just a couple of creams, a good sun cream with an antioxidant cream, something like vitamin C, or in severe cases like a retinol, mild retinol, 1.5, 2% retinol. That's good enough for a good skin.
Okay, amazing. You don't have to do a whole lot to keep having a really amazing skin. All right. Thank you so much for your time. Thank you for being with us. Thank you.
Yes.
All right.